This is another episode of Experiences in Medicine, and this will talk about the fallacy of medical residency selection. One of the things which medical students don't think about, especially when they are first applying to medical school, is deciding what they will do after medical school. In many parts of the world, when you become a doctor, you actually finish anything from 4 to 6 years, and subsequently after that you could actually practice in the community. And most people are kind of family practice, general practice doctors in many parts of the world, but the United States system is different. In the last 20-30 years, every single person seems to have a residency program, whether it's just even in general practice, internal medicine, orthopedics, surgery, or anesthesiology. And over time, because the cost of medical school has gone up, the average cost of debt medical students have is anything from 250 to 300,000 at the end of 4 years of medical school. And like many people, this debt is quite not justified based on the fact that there may not be such a significant difference in outcomes in people who are trained with significantly less cost as in other parts of the world and are able to achieve exactly the same, if not better, outcomes in the United States. So this would be a topic for another discussion. But back to medical residency selection, the fallacy. So for many people, once they finish, they now have to apply for residencies. And over time, I think the joke now, has occurred among the medical students where they call the road, meaning the road to wealth. And 4 major residency programs are the road to money, meaning radiology, orthopedic, anesthesiology, and dermatology. And this residency people get into this highly coveted residency by getting higher score on what is called the United States Medical Licensure Exam, or otherwise shortened to the USMLE. And then these scores become the way in which the residency program directors are now selecting candidates to decide who gets into this residency program. So on a percentile basis, if you score 98th percentile, then you are more likely to get into more coveted residency. And if you score a 78, because where the pass mark is 75, you are less likely to get into these residency programs. But what's the fallacy of that? The fallacy is that, first of all, at the medical student levels, many doctors have become what we call high-yield doctors, which we've talked about in the previous discussion, where the concentration is not on what they actually learn from medicine, but is being able to pass an exam to be able to score a higher score. And therefore, you end up choosing a candidate not because that candidate is the best candidate, but only because the candidate is able to pass the exam. So often enough, many residents enter into a residency program, and basic, common sense, logical, medical way of thinking eludes many of these residents, and eventually they graduate as specialists or consultants, but their core medical knowledge is suspect. I believe that this system needs to be changed. There must be a deviation from using exams and a using of actual residency or medical student experience and recommendations to choose, rather than sole reliance on what people score in a USMLE exam. I'll talk about this at a different point, but I think the fallacy of choosing based on score makes you result in people who are only exam oriented but lack the true knowledge of medicine.